Welcome to Urology Centers of Alabama. I'm Thomas Holly, and I'd like to discuss one of the many robotic surgeries we perform here, the subtotal or simple prostatectomy. Benign prostatic hypertrophy, or BPH, is a benign, non-cancerous growth of the prostate which can lead to worsening of urinary symptoms. The treatment of these symptoms has evolved dramatically over the past several decades. Advances in medicinal treatments have allowed most men to control their symptoms effectively with just medicines for extended periods of time. However, some men's symptoms will continue to progress, leading them to consider surgery. The surgical options today are varied and many choices are available. When selecting which therapy is appropriate, a number of factors should be considered. One of the most important determining factors in deciding which surgery to perform is the size of the prostate itself, which can be evaluated via transrectal ultrasound or cystoscope. The traditional therapy for men with a severely enlarged prostate was via an incision in the lower abdomen through which the obstructing portion of the prostate was removed manually. Following removal, both a Foley catheter and a suprapubic catheter were routinely placed. This procedure was called a simple or subtotal prostatectomy since not all of the prostate was removed, just the obstructing portion that blocked the urinary stream. The advantage of this approach is the ability to remove more tissue, which leads to a lower retreatment rate. However, the disadvantage was a longer hospitalization and recovery period. Today, with the advent of robotic and laparoscopic approaches, these shortcomings can now be overcome. At Urology Centers of Alabama, we have been dedicated to robotic and minimally invasive surgery through our experience with thousands of robotic cases and have begun to advance the applications of this technology. We performed the first robotic simple prostatectomy in Alabama in 2008 and are now routinely performing this surgery robotically. This allows our patients a shorter hospital stay, less blood loss, and additionally eliminates the need for a suprapubic catheter. The procedure is performed by making small incisions in the lower abdomen and inserting the robotic instruments. The bladder is then opened and an incision is made directly over the enlarged prostate. The central obstructing portion of the prostate is then enucleated under direct observation, which allows better preservation of the urinary sphincter, improving continence. This approach will also allow us to remove any bladder stones if present. Once the obstruction has been removed, a Foley is placed and the bladder is reconstructed. The usual hospital stay is 1 night and the Foley catheter will remain in place for 6 to 7 days. Most men postoperatively are able to stop their pre-surgical prostate medications. So in summary, we feel robotic surgery has advanced the surgical treatment of large prostates by the ability to minimize blood loss and reduces the convalescence period. We feel that our vast robotic surgery experience in all areas of urology here at Urology Centers of Alabama allows us to achieve successful patient outcomes and better apply robotic technology to a more varied disease process. We invite you to review our website to find answers to your questions and find contact information for further questions you might have.